Welcome to another edition of Cannabis Conversations. Today we'll be speaking to Dr. Bonnie Goldstein, who's the medical director of Canna Centers and author of a book called Cannabis Revealed, an excellent book actually, and it will be brought out a new edition, revised, brought up to date next year by a major publisher. Congratulations, Bonnie, for that.
Thank you.
So Bonnie, we are now in the 10th anniversary of the reintroduction of CBD into the medical marijuana community in California. And since that time, CBD has undergone a bit of a transformation culturally. Now it's like mega global. It's a big fad. I'm wondering, how has that affected your practice at all?
Well, it's interesting. I think more and more people are open to medical cannabis as a concept because of CBD. Remember, going back many years, we were all kind of trained that THC is bad for you and marijuana is bad for you. And so many people have been propagandized against cannabis. And CBD kind of like opened the door a little bit and now really opened the door. And I think the big question is for many of the patients that I see, is CBD enough as a compound in and of itself to be beneficial, or does CBD need to have all of these other compounds from medical cannabis that come with it, that are there in the plant that nature gives us?
What are you finding in that regard?
Well, it appears that there's a small subset of the population where either CBD isolate or CBD dominant with very little THC, but maybe some other, the secondary cannabinoids, may be beneficial. But there's no question in my mind that whole plant with a more balanced approach really seems to help more people than just, CBD isolate or CBD by itself with a small amount of other plant compounds. I joke around with people that like 100% of patients that come in who've already tried CBD have not found that it's helped. They'll say, oh, I tried CBD, it didn't work. I mean, I hear that all the time. Or, I was waiting for an appointment with you and I put my child on it because we were desperate and, it's just not doing the trick. Now, some of that is the product that they're using. Some of that is the dosing that they're using. There's appears to be, again, a small amount of patients or subset of the population where a low dose of CBD may be beneficial. Very hard to separate out placebo effect from, oh, I'm taking this and everybody tells me it's gonna, I read online it's gonna help me and everybody tells me it'll help me, versus patients who really do need much higher doses for serious medical illnesses.
And you mentioned some of these other compounds that exist, the minor compounds, like minor cannabinoids as they're called in the plant. Thus far, really since the passage of California medical marijuana in 1996, up until now, it's either been all THC or CBD has entered the picture, and now it's a matter of mixing CBD and THC, and it helps to manage psychoactivity. The more CBD, the less THC, and so forth. But is that all there is? That's a lot, of course, but what are you finding, if at all, in terms of the other components of the plant that you are able to work with?
Well, so here in California, and again, it may be true in Colorado or some other of the states that have had laws for a longer time, we have now available CBG, so cannabidiol, which is another cannabinoid that has medicinal value. So it's an analgesic, anti-inflammatory, antidepressant. It's a bone stimulant. It's anti-cancer, proliferation. And I've been using CBG just about in the past year or so, maybe a little bit longer, in patients who have depression who did not find benefits with CBD or THC. Also, a large number of my patients, take care of a lot of children who have autism, are finding that CBG works very nicely for anxiety. And so we've done some polling with a nonprofit, And they're reporting the number one benefit for CBG in children with autism is less anxiety. And that's a big, big problem for most people who suffer with autism. We are also using THCA. And THCA, as you know, is the raw part, or the raw part of the plant that when you heat it up, it converts to THC. And so THCA I'm using a lot in also in kids with autism. We're using it as an anti-cancer agent in some patients. For some patients it works beautifully as an anti-nausea. I have patients who have to take certain medications for their life-threatening illness. Those medications cause nausea. Well, they're using THC to counteract that. And again, for many people, the best part of THCA is low dose works, and it's not intoxicating, so if they want to use it during the day and THC bothers them during the day, then they can use the THCA.
Maybe you can explain a little bit what that A means when it's attached to THC, or even more to the point, really, CBDA, and what your experience in that regard has been, if anything.
Sure. So CBDA, again, raw form of CBD. So the way that people should think about it is, here's the flower, right? We just cut the flower off the plant. If you test the flower in its raw form before anybody heats it in any way, you're going to have most of the molecules in what we call the A form, the acids, so tetrahydrocannabinolic acid, and then cannabidiolic acid, and it's not like an acid for some people always say, well, is it going to burn me? It's not that kind of acid, it's just the chemical structure that allows it to fall into a category of acids. And then what happens is if you heat those compounds, you decarboxylate them, taking off a carbon and a couple of oxygen, and that's what turns THCA to THC, and that's what turns CBDA to CBD.
And does that really make a difference in terms of the therapeutic properties of these compounds?
It's such a great question. Yes, it does. But there's overlap, because all of these cannabinoids overlap. Both CBD and THC are anti-anxiety, right? So is CBG now that we're finding in a lot of patients. Why are all three anti-anxiety? Well, that's the overlap. But it appears like some do better than others. I'm finding that, so we know from studies that both THC and CBD are both anti-nausea, but in clinical practice, I'll tell you THC works much better than CBD for anti-nausea. Well, THCA works really well for anti-nausea too, but of course they work differently because they don't work at the same exact sites of action in the human brain and the human body. So when you think about all these different cannabinoids, for instance, now we're talking about 5 different cannabinoids, right? THC, CBD, the acid forms of those two, and then CBG. Again, there's overlap and redundancies, but at the same time, in each specific person, they're going to respond a little bit differently. You may meet people who say, well, CBD worked great for my anxiety, and then there's going to be people who say, well, yeah, I just didn't get that result. But then they use another one, CBG maybe, or THC, and they find that, that seems to enhance. What's interesting about THCA and CBDA in terms of clinical practice too is I am finding that it's very helpful for inflammatory conditions, especially combining them.
Even more so than the non-acid, the neutral form, CBD, THC.
Again, it's always hard to say when you're comparing a little bit, but the overall sense I'm getting is that the acid forms, you can take less and seem to get a pretty good effect. You don't have to take as much. And it allows for people to use these compounds daily without having to feel intoxicated.
Mm-hmm. So THCA is not intoxicating, even though THC is.
Correct.
You mentioned CBG before. Just going back to that, because I had another question that came to mind. And you spoke about your experience with autistic children, and it seems to lessen anxiety quite a bit. Have you seen similar anxiolytic properties in other contexts, maybe not with children, maybe not with autistic people? Have you had any experience in that regard?
So in a small percentage of my patients who are adults that I've been taking care of for years, who come back every year to re-up or to ask, they email me and ask questions. Every time a new cannabinoid kind of gets on the market, I let people know about it, and I'll say, if you're still having some breakthrough anxiety, if you're still having breakthrough pain, you might want to try adding in and just see. I have this saying that I use in my practice, rule it in or rule it out. I do think there are a lot of people out there that think that you can just take somebody's symptoms and then give them some kind of cannabis regimen and that's what's going to work. And that's not really how cannabis medicine works. You want to be able to fine tune and kind of be able to dial in. But now with so many cannabinoids, I tell people it's worthwhile ruling in or ruling out each one, seeing if it suits your chemistry. And remember, this is complex. We're taking this really complex plant, right, with hundreds and hundreds and hundreds of compounds that are somewhat redundant and even opposite, right? Mm-hmm. And then you're putting it into a very complex human being, and you're saying, oh, I'm going to easily, it's like this and this, or they stick together. Well, that's not really how it works. It really has to be the patient's response that kind of dictates maybe where you go next or how you think about dosing. And remember, too, that with cannabinoids, there are people who respond to very low dose. And I'll give an example. I had a patient, a little boy, come in with autism, and the parents were desperate. And so they tried a little bit, and when I say a little bit, I mean a really little bit of CBD before they came into my office. And they told me that 1 week on that very low dose, in fact, a dose so low that I don't ever even recommend a dose that low, I always start a little bit higher than that, that the teacher had already noticed that the child was doing better. And the teacher did not know he was on CBD oil. But she made like a beeline for the mom one day at the end of school and just said, okay, what's going on? What's different? Because it was such a complete benefit. And at that simple, tiny, low dose, like about 4 or 5 milligrams, they were seeing this incredible benefit in this child. And then I have other patients that are at the complete opposite end, right? 100 times that dose, 400 milligrams, a little child with autism. So why is that? Well, we have to remember that this is a kind of a, changes in your neurotransmitters, this is on a cellular level. This is not something that's so easy to measure, and there's no way to tell by somebody's size or level of illness, really, exactly, what's going to fit them. And it's the same thing with the different cannabinoids. You're not going to know until you try and see. Again, rule it in or rule it out.
Well, we might not be able to measure, cellular happenings, and yet you see measurable results, sometimes astonishing results in your practice. And what's always so great to talk to you, Dr. Goldstein, is not just the information, but the inspiration. Maybe we can end with an inspiring story of a case that you've been involved with recently, because each time we talk, there's new things that you tell me that I find so inspiring and so amazing.
Well, a really wonderful story that I hope I don't jinx by talking about, because we're still in the middle of treatment. I recently had a young woman come to me, a teenager, who had very advanced bone cancer called osteosarcoma. Her cancer was so advanced that it's actually kind of popping out of the bones through the skin in her legs. She also had a very large metastatic tumor in her lungs that was requiring her, it was inoperable, they were told, by the time it grew to this size, inoperable. She was on oxygen. She was on pain pills. She came to my office in a wheelchair. And I have a patient who I was successful in treating his osteosarcoma with a combination of cannabis plus certain chemotherapeutic agents. And in the literature, there's an article in Mice that shows that cannabis plus this particular chemotherapy, that combination is pretty good at cancer killing, when separately you may not get there. So this combination seems to work. So this young woman, we put her on pretty high doses, and in fact, I'm very aggressive when I treat cancer patients. Her father was even more aggressive and gave her even more cannabis oil. She's on a combination of CBD, THC, and CBG, THC, and CBD. And she already has both tumors in the legs, like I said, were very ugly and big, are now not even showing signs of being cancerous anymore. Now it's just necrotic tissue that her body has to clean up. So her PET scan, which lights up cancer, is not showing any lighting up. And then the pulmonary tumor, which started off at around 12 centimeters, is now down to half its size. The father is this kind of spectacular thinker, and he figured out he didn't want to look at it as a 2D, he wanted to look at 3D. And we basically figured out that the tumor in her lungs has shrunk by about 85%. And this is just in 6 months' time. She's out of the wheelchair, she's off oxygen, she's off pain medicine. She was able to go back to school in September, and she even made a trip to Colorado to go visit some family and friends. It's been really an amazing journey.
Maybe one more question, because you did speak of the using both conventional chemotherapy and cannabis oil together. I think sometimes people are, either or, either one camp or the other. They're going to stick with the conventional medicine. They're not going to give a thought to cannabis. Or sometimes that's really the other way. They want to do the natural way. They won't consider anything like conventional chemotherapy. Yet what I'm hearing from you is that maybe we should be thinking a little out of that box and considering combining. I'm not asking you to give advice to people who've got cancer who might be listening to this video, but what maybe you could expound upon that a little bit.
Look, we don't have the ability to do clinical trials, right? We're still living in prohibition, even though here we have it in California, right? In 33 states, and then 8 states have legalized. But in terms of research and really understanding how does cannabis kill cancer? Remember, cancer is lots of different diseases. It's not one disease. So to say cannabis kills cancer is like saying the sky is blue. Well, I mean, there's so much more to it, right? It's very hard for me, again, as a doctor who trained in the sciences, to say, well, just take cannabis. I mean, I don't know. So until we know better, what I say, especially with pediatric cancer, is you're going to throw everything you can. But you want to hang some of your hat on science, right? So what science do I have? There are a handful of studies that look at cannabis plus some of the chemotherapeutic agents in terms of either cancer killing, right? Or in terms of cannabis mitigating some of the side effects of these very toxic medications. And so when a patient comes in who's on some traditional chemotherapy, I always make sure I do a review of the science and the literature to make sure that we know exactly that we're not negating them. We don't want to negate anything that we're putting into one person. But look, there's research now that's coming out of a pharmaceutical company in Great Britain that is taking some scientific literature from mice where we for a very dangerous and deadly cancer of the brain called glioblastoma multiforme. Most people may know that as the tumor that John McCain
It's pretty much always
away.
fatal.
Yep.
Yeah.
15 months under the best care, 15 months from diagnosis to, and I think that's, after 5 years, maybe 15% of people, if that, are alive. It's deadly. And we're not doing a very good job as doctors of getting rid of this cancer. And there's some evidence that these cancers that are in the family of gliomas are very sensitive to cannabinoids, okay? So there's a study in mice that shows a certain chemotherapy plus cannabis kills cancer, and now there is a pharmaceutical company that has not published the report, and one of the reasons I think that they haven't published, I don't know firsthand, but my suspicion is because the patients are living. So they did report at the end of 1 year that 83% of patients who got the combination of CBD, THC, and chemo were still alive, whereas the patients that got chemo alone, 53% were alive. And again, it's a small group, I think 20 patients, but there's certainly something there that is statistically significant, not to mention that those patients taking THC and CBD seem to have a decent quality of life. It's not like we're adding on more toxic chemicals on top. I think when it comes to the pediatric patients, I try to be very respectful of what the patients are on. I review, the literature. I try to make sure that we're not going to get drug interactions. Unfortunately, even though we are where we are right now in California with cannabis, I'm still, even this week, had a patient that came in who said, my doctor told me I should not give cannabis. In fact, she said CBD to my son with leukemia because they don't know long-term what it'll do to his brain. Well, I know what chemotherapy does to children. We know about 60 to 70% of children who survive pediatric cancer have significant medical conditions that they have to deal with the rest of their lives. And if cannabis can change some of that, Knowing what I know and seeing what I've seen now, having patients who survive cancer and then only continue with cannabis, they're taken off chemo, they live a great quality of life, and I'm certainly not concerned about their neurocognitive abilities or really any organ damage. I mean, it's kind of amazing.
Inspiring. Well, thank you very much, Dr. Bonnie Goldstein, and we are signing off now from this edition to Cannabis Conversations, but we look forward to speaking to you again.
Thanks so much, Martin.